Welcome to Navajo County Connection. I'm your host, Supervisor Daryl Seymore, and today we have Shawn Morrow as our guest here, CEO of Summit Healthcare. Welcome, Shawn.
Thank you.
Glad to have you with us today.
It's my pleasure.
Welcome to Show and welcome to the White Mountains. You're fairly new to the area here, and when did you move?
We arrived right at the end of July.
Okay, and so you've been a little bit summarized, but tell us a little bit what transition to cause you to come to Show. Why did you choose to accept the position that was available here at Summit? Sure.
So I've been working for Intermountain Healthcare for the last 9 years in Utah. Intermountain Healthcare is a very large system. They employ around 40,000 people. Prior to working for Intermountain Healthcare, I led independent, small community hospitals. And that's really where my passion is. I love the work environment when you are working in a community where that hospital is the primary provider of care, where we're integrated with the economic well-being of the community, and where we can actually drive a change in health. Not just health care. So to me, that's really rewarding and fulfilling. Summit Healthcare has a great reputation. I've been looking at Summit Healthcare for the last 3 years. Ron MacArthur, I knew his retirement was on the way, and I think he delayed a couple of times for the good of the organization. And so I've been researching and looking at it for quite some time, considering whether I would put my name in the hat for it. And when it did finally come open, I did, and interviewed and found that it was a great fit for me and my family. Great.
Did you know Ron at all before interviewing? I think there's a little bit of history there.
I did, almost 15 years ago. We were both in Oklahoma. Ron was overseeing about 16 hospitals as a regional manager with a hospital management company, and I actually worked for Ron for about 3.5 years, and then we didn't talk too much, maybe once every 4 or 5 years, and then about 3 years ago he called me and said, I'm thinking my retirement might be coming up, and the board had tasked him with pulling together a number of candidates that they could review. So,
well, congratulations on the position, and thank you for accepting it. We look forward to being able to work with you on the many partnerships that we do as a county, as well as the cities and towns and people in the community here. Summit being the largest employer of Navajo County, how many employees do you currently have now?
Right around 1,400.
Okay, and so that is huge in the number. When we look at the different businesses and things here, that is a big economic driver for our community and things that we have. What are some of the things that you have been challenged with a little bit here with COVID, and then some of the changes or some of the direction, if there's any change that you see on the horizon of what you want to do during your tenure, some of your goals that you have for Summit?
Sure, thanks for the question. So COVID's been a unique challenge for most hospitals across the country, most markets. As a standalone independent, it's provided some unique challenges for us in that we don't have sister hospitals inside of a system that we can share resources with. So we have 101 beds. Today we have roughly 30 COVID inpatients. So you can imagine the difference that makes when you have a new virus, a new disease that hasn't been there before, that's putting 30 patients in your hospital. We've been full, our medical and surgical and ICU beds, for all intents and purposes for the last 2.5 months since the surge started. So that creates sort of some bottlenecks and backlogs, primarily in the emergency department. So we've had to bring in, we have almost 70 traveling nurses right now. Our nursing teams are amazing. They've worked 5-day, 12-hour shifts, sometimes 6 days a week, 12-hour shifts. We've tried to give them a reprieve by bringing in the traveling nurses, and so they've had a little bit better workload for the last month, but that's not sustainable.
Right.
So we're incurring a significant expense every month to have traveling nurses in here, and it's definitely straining hospital resources. It's not the best scenario when patients are backed up in the emergency department because there's not a bed to put them in.
Right.
So we're doing the very best we can. Our emergency department is phenomenal, but I'm sure we've had patients who have felt the longer wait times. We've had some patients that have needed to hold in the emergency department for lengths of time that are too long.
Right.
So we're doing everything in our power. We've opened up a couple of surge spaces to try to unbottleneck the emergency department. So we're definitely feeling the strain, but we're built for this. It's our sense of purpose. Our mission is to provide trusted and exceptional care close to home.
I think you guys offer such a variety of things that we didn't have on the mountain 5 years ago or 10 years ago, as far as a patient to be able to be diagnosed with something, and many times they had to leave the mountain to get that care. And now, right now, you've got everything covered, from cancer patients to, transplant, probably not that part yet, but as far as replacements of knees and elbows and different things that you have, I think all of that is done locally here now, right?
There's a lot done locally. We're still careful to make sure we don't try to do what we can't do. Our preeminent concern is always safety. There's the saying in medicine, first do no harm. So we're really cautious about what we do. We want to make sure when we add a service that we can do it as good or better than anybody else. So the services we provide, we feel like we can do that in those arenas.
That's fantastic. Don't want to spend all the rest of the time on COVID, but there is something special about, maybe it's kind of an experimental drug, not really experimental, but I don't know you're going to pronounce it right, but I'm going to have you tell us what it is that the hospital can give if somebody does have a severe case of COVID, that you're able to give them, and it's selective, and it's also, there isn't every hospital that has that opportunity right now.
Yeah, so monoclonal IV therapy is the treatment. It's been proven very effective in certain patients. So there is a screening process to determine who it will work with their body, their symptoms, their situation. But we are encouraging people, this is really important, if you do an at-home test and you test positive, call your primary care physician immediately. Ask them about monoclonal IV therapy. They'll screen you, they'll find out if it's appropriate for you, but it is a preventive, hospital avoidance type of treatment. So once you're positive, ask your primary care physician. If it's appropriate, you can get in immediately for that treatment. It's an outpatient treatment, but the numbers are pretty significant in hospitalization avoidance.
That's great.
So we really encourage people to, again, contact your primary care physician immediately if you diagnose positive.
I think it's phenomenal when you look at the hospital and you look at the situation, you guys are used to doing all these different surgeries and outpatients, and that's really where your bulk of your dollars come in to sustain everything that you have. And then to have a pandemic like COVID hit, and now all of a sudden we can't do what we normally do to a large extent, and for a period of time we were even shut down from being able to do those type of things. It does strain your resources, and you were getting some compensation from the state and from the federal government initially, but that is all stopped. And so I understand that these nurses that come in, and we're appreciative of them, we're appreciative of the people that are working extra hours and putting in extra time just to give care to citizens in our community. And you guys need to be complimented for how you have taken that and helped with the area, and with it being a high pandemic area. At one time we were #1 in the nation for a short time, Navajo County. That wasn't something we're proud of, but but the statistics showed that. And to be able to be now where we're having business, we're having commerce, we're having things, but we can't let up from the fact that we do still have a disease that is infectious, a disease that is life-threatening, and we just all have to continue to be effective preventing it, do what we can, our part. Everybody, if they're able to be vaccinated, I think you can prove numbers have changed that people who have been vaccinated and have came into the hospital, how their recovery has been versus those who were not.
Yeah, it's really conclusive. There's no question mark behind this data. Over 90% of patients that have required hospitalization are unvaccinated. So when you get vaccinated, it doesn't mean you're not going to get COVID.
Right. And I can attest to that. I was vaccinated in April, and I recently, you know, myself and my wife had COVID, so yes.
But what that vaccination does do for you is it dramatically decreases the likelihood that you're going to have acute symptoms to the point that you require hospitalization. And we're finding the same thing for patients that we can admit to our COVID at home, which is a program to avoid hospitalization. But it's the same thing, very high percentages of those patients, you know, same thing, unvaccinated. So they're acute, not quite acute enough to need a hospital, but still really high unvaccinated rates when they go into that at-home program. And then the percentages of unvaccinated go up for those that are acute enough that they require a hospitalization. So we would love for people to not require the hospitalization.
Right. So now we're going to get into a little bit of who you are. Okay.
Sure.
You know, we got this coat and tie. We've got the serious doctor approach, the manager side. But let's peel back a little bit here and tell me a little bit about you growing up, what your family life was like, and what that sweetheart person was that entered into your life, and from that, what's happened kind of since with your family life.
Sure. So I grew up in Orem, Utah, for the most part, and back when I was growing up there, at least half the town was a fruit orchard.
Right.
Lots of big orchards, so we grew up picking cherries and working in the orchard to make money. I loved baseball as a child. That was in any other sport, basketball, tennis. In my family, we grew up very humble. We were quite, I would call it quite poor. My mom was diagnosed with cancer when I was 12, and so I've personally felt the impact of medical costs. I remember coming home as a teenager and flipping the light switch on, and the lights didn't come on. And I remember walking in, and there was no heat, and wondering why why there was no heat in the house. Well, we had huge medical bills. And so a couple of times the electricity, you know, we couldn't pay the electrical bill, so the electricity was turned off, or we couldn't pay the gas bill, so the gas was turned off. So that's sort of how I grew up. My mom passed away when I was 17 from cancer, and I have, there's 6 of us kids, and I think it's no surprise, you know, that 4 of the 6 ended up in healthcare. I think that had an impact on us, and we felt a tremendous sense of purpose. I firmly believe we interact in healthcare with people at very sacred moments in their lives.
I'm sorry for that obligation in your life, but sometimes tragedies become blessings too.
They do. They shape us. They shape us. So that was sort of my childhood. I served an LDS mission, mission for the Church of Jesus Christ of Latter-day Saints in Brazil. Played baseball it was Utah Technical College at the time, and then went and served a mission for a couple of years, and then came back and played another year there at Utah Technical College, and transferred to BYU.
What position did you play?
I was a catcher.
A catcher, okay.
I like being the general on the field.
Right. And you like the guy running you over at home plate?
Yeah, that part wasn't so fun.
Arguing with the umpire?
No, I tried to make friends with the umpire. Needed those you know, strikes called.
Okay.
And then met my wife at Brigham Young University, Ashley. She's from Oxford, Mississippi, and fell in love, dated for a couple of years, and got married, and we've had 4 children. So we have a 25-year-old who's married, and a 6-month-old granddaughter by them,
All right.
and then a 23-year-old daughter and a 20-year-old son, and a 16-year-old son. So a 16-year-old is a junior at Show Low High School.
That's fantastic. So we got some height on our basketball team or sports team there a little bit.
Well, he's 6'3", and he's still growing.
All right.
So about 1/4 of an inch every 3 months. We'll see if when it's going to stop.
I had the opportunity of meeting him, and he's a great young man.
Yeah.
That's fantastic and things there. Now you love to go out and play a little bit of golf too.
I enjoy golf, yeah. I enjoy a little bit of golf. I like to fish. I actually love to fish.
Fish there.
Like to play golf, love to fish. Started playing ice hockey when I was 40, so I've got to find a way to get a sheet of ice up here. So I don't have to try to drive over to Flagstaff too often to play. But enjoy that, and just enjoy being outdoors. We like to hike and those kind of things.
So you fit right into the mountains, the rivers, the streams, the hunting, the fishing that we have here in the White Mountains. Was that part of your decision process making when this was available?
Well, the White Mountains were for sure. Yeah, the fact that there's so many trees, that there's sort of the mountainous terrain, the elevation, the 4 seasons, for sure that factored in.
Into it there.
Yeah.
Getting back to the hospital, what do you see the future, some changes with things that are going to be happening? You know, what is your pioneer spirit going to take you and summit that you want to try to, you know, move forward now?
Yeah, so the entire healthcare industry is going through a transformation, a disruption, and it's a good thing. We're one of the last to do it, probably us in education. And that transition and that transformation is all around affordability, because healthcare is not affordable. Still not. We've made some inroads, but we have to create a more affordable product that's more consumer friendly. So creating a better digital front door, and not just a front door, but when you get in that digital front door, what can you do from home, or your car, or the campground, or wherever you're at, that provides solutions for your health care issue. Driving care into lower cost settings, so getting upstream and working on health rather than health care is a massive priority. We've had real success with the COVID at home. We're going to expand that into a hospital at home, where for certain diagnoses we can provide treatment protocols where people can stay in their home with remote monitoring and other devices. So the application of technology is going to help us, I think, get upstream on some of our care processes. Behavioral health is a big upstream care issue right now. Most of the behavioral health, I don't know if most is the right word, but a significant portion of behavioral health needs in our county are landing in our emergency department. That is not the appropriate best point of care for somebody with behavioral health, because they get triaged down because you got somebody with chest pain. So we need to find better solutions for behavioral health that are not in an acute care hospital. The same thing with detox. Our emergency department has behavioral health and detox holds of upwards of 120 hours every day, and 24-hour period when you pile those patients on top of each other. We want them to get the very best care and treatment that they can get. And evidence-based best practice says that's not in an emergency department. So we're going to find ways to partner with entities to provide better care for behavioral health and detox. Those are just a few of the things, but the real push is for affordability and how do we redesign ourselves so that we're providing care how, when, and where people want it, and in the lowest cost setting we can possibly provide it. And our payment mechanisms don't always align those incentives, so we have to also adapt and move into different payment models where we have aligned incentives to keep people healthy. So self-insured plans we need to get really good as an organization at tracking chronic care conditions and having best practice chronic care protocols in place so that we keep the diabetic patient from landing in the emergency department and having thousands of dollars in bills every year.
You know, it's interesting. I know that Navajo County, with their department under their program, has taken that on with diabetes. So through their health plan, you can get on a program, the Verta program, which allows you to work on your glucose, to work on those levels, to reduce some weight, reduce things so that you are not diabetic or become less pre-diabetic and become healthier. So as we do that, that is just part of health costs and keeping the costs down for health care for employees and for everywhere that we turn going forward.
Yeah, exactly. And we're designed really well for health care. We're transitioning and have some elements where we're designed a little bit better than we ever were for health, but we're not anywhere close to where we need to be.
That's great. Well, I sure appreciate sharing with you today and you sharing with me these comments about yourself. I know we got into some of those personal moments there, but I think that defined you, and it defined, you know, who you are and the success that you want for others. And as we look at that and we look at our citizens that we have throughout the county, we're fortunate and blessed to have Summit Healthcare here. And we're grateful to have you as the leader of that. The CEO, I know you have a board you have to answer to, and they direct things, but it really stops with you and your leadership and what you can share. And we're grateful to have you. And we just want to welcome you and just want people to come by. And you know, at times you're a very personable person. You're out in the community. I know that you have the community interest and you want to continue to be a partner with many of the organizations that you have in the past.
Thank you. It's my pleasure to be here, and I look forward to serving the community.
That's great. Well, Shawn, you have a great day.
Thanks, Daryl.
Appreciate it. Thanks for watching today, County Connection, and we look forward to seeing you next time. Have a great day.